Welcome to the webinar about Key4OI and specifically the Key4OI registry, which is something that is entirely new, and therefore it really warrants that we explain that properly and that everyone has an opportunity to think about it, think about what it means, also help us shape it in a way that it's really beneficial for everyone who needs to work with it. Because one thing is for sure, we've put a lot of effort into this, so it is here to stay. It is very low in terms of cost. It really has been built up till today by an incredible amount of people volunteering, and by and large, we want to keep it that way. And in that way, it really is a how do you say it, a citizen tool for research citizens and for OI community citizens to really make the most out of understanding OI and helping to improve the quality of life over time. So the purpose of this webinar is to make sure we briefly stand still on the why do we even need another registry? What is it really going to measure? What is it for? And how does it work? So I'm going to try to go quite fast so that the full ground is covered and a lot of things have accumulated, but I really want to be as transparent as absolutely possible. And again, if there are still questions left, please put them into the chat because I'm very keen to answer all of them. And we also have already a frequently asked questions document on our website, which we can always expand with your questions later on. So let's dive right into the why does it even need to be there, this Key4OI registry. So this slide shows you what the original idea was. We wanted to measure. We first wanted to take the most commonly used effective measures for OI, and we searched and researched, and we couldn't find a good common denominator. Nobody really starts to say, let's create something completely new if something exists that works. And I think that was something that the project team found clearly. There was nothing like that at this point in time. Many different measures were being used. And from that point of view, we started to think about the idea, what if we define with approaches that are very much linked to the World Health Organization and the international functional classification of functional outcomes for every human being on Earth, standards that have been agreed across the globe. What if we use that to describe OI so that we have the minimum common denominator? And then we can, for each of those segments, start to really build on each other and learn faster. That was kind of the fundamental, very simple idea. And we realized everyone with OI is different, surely. And I think we also realized by now that there's certain things that we have in common. And on this very important point, which I discussed a lot in the early days, I keep referring to women, for example, research about women. Every woman is surely different and unique. At the same time, surely women have something more in common than with maybe men in certain biological areas, for example. So even though everyone is unique, there are certain patterns that sometimes we can't see at this point in time because we don't have an infinite number of resources and people thinking about it. This is a rare condition. So what we can do is we can make it all a bit more structured and focus on certain areas that we believe are really relevant for quality of life. So that is really what we embarked on. And these are the first visuals, really pretty ugly at this point in time if you look at it. The circle and the kind of letter font, all pretty bit old-fashioned. But from the start, we had the person with OI in the center, which is Rebecca, and a person that we know very well, who has agreed to be our kind of visual center point for Key4OI, which we're very grateful for. So we basically embarked with a group of 25 experts onto this journey in 2018. And so when we talk about why do we exist, all those super experts all felt there was value in having consistency around some of the measures of outcomes, because if you can measure the outcome in a consistent way, it really helps you determine who actually has better or not so good interventions, right? So everyone will benefit and we will have better science as an outcome. So all those people felt this is a really good thing to do. And what you also see is that there's a bit more than 23%, I think, people with OI involved right from the start in this expert coalition. In everything we do in the Care for Brittle Bones Foundation, we have a very strong voice of people with OI built right in from the start at the table, not just as giving input from the sideline. It's part of the project team. And out came a choice for the World Health Organization and certain standards of quality. ICHOM is a good one. I just want to mention it briefly because it's for me also still today the absolute inspiration for all the work that we do. It's the International Consortium of Health Outcome Measures. It's linked to Harvard, and they have an incredible amount of experience, and they coached us all the way through the process. What also happened is you don't want to create a outcome measurement set without the strong voice of people with OI themselves. So we had focus groups all around the world. On the top left-hand side is the German group, which I remember, and on the bottom left-hand side is the Russian group. And there were groups also in Hong Kong. So a lot of different groups came together to discuss, and then we had groups for adults and groups for older children, obviously with the consent of their parents. Everything completely designed for the flow of the session, 5-hour-long sessions, really, really in depth. And we partnered with many different patient organizations around the globe. You see them on the top. They all helped us to access the patient communities and have them think together in a structured way. And out came this spreadsheet, and I hope you can all kind of relate to that, how these things then have emerged. We have looked at all those different countries and the adult and the children and adolescent group, and we compared that to the areas, and we found, wow, there's actually a lot of consistency. If you just look at the Netherlands, for example, it really gave us a quite a consistent picture of some of the most important things that probably should end up in our Key4OI measurement set. So we published it in 2021 with all those 25 people that were previously on the picture. And this is what you then see as an outcome. So these are the areas, this is the what, that we have developed with this group of people. So those areas that you're seeing here are collected in the Key4OI registry in the end of the day. Let's start on the top right-hand side, between 12 and 3 o'clock, so to speak. Major events, so anything that would be a surgery or fractures, for example. Surely for many of us, major events in our lives and therefore need some attention. But then there's also the ongoing measurements in the top, bottom right-hand side, my body, growth and weight, bone mineral density, and all those other areas that you can see there. What you also notice is that there's certain things maybe that are missing that you care for. We really tried to make it digestible and just about digestible enough for any multidisciplinary team. So we had to leave a couple of things out that surely would be great to collect. And I totally don't want to exclude that we will collect them because that's really what this whole environment is built for. It's built to be adaptable to our increasing needs and our new insights. At the moment, we're looking a lot at the gut, for example, the digestion system, or at the heart, for example. And those things can be easily bolted into this, and then it can become all together even more valuable. And therefore, I'm really honestly very interested to hear what the topics are that you're painfully missing. And I remember very much that in the beginning, when we started Key4OI, lung was missing, and that some people were very upset about it. And you see, it's there. So we definitely continuously make it better and improve on it. Now we have the active living one, which is all about independently living your life. That means mobility, but it also is about other self-care functionalities. And then on the top left segment, quality of life, this is that important area where people with OI themselves usually know best how they're doing in terms of emotional well-being, their social participation, fatigue, or pain. So it's a combination between clinically reported outcome measures and patient-reported outcome measures. Two very different types of measures that are very, very important. So this is really giving you a good overview of the measures. Underneath the next level of detail is a lot to take in. So I'm probably not going to go there right now, but I do want to show you briefly the kind of help tools that we've created already and that are free of charge for download and use, available for everyone already now on a website that I will show you again in a moment. So we have a checklist, for example, that people can use as they're going to a multidisciplinary team moment to think about some of the things they may want to ask, because if you are well prepared, that is usually the best way to prepare a good conversation, get out the value that you need. But also on the right-hand side, the compass, which is a way to make sure you take stock every so often on what you really want to achieve. You know, do you want to work on all those many different pieces of the pie, or is there maybe 2, 3 things that are most important as you are entering your study or whatever it may be? So really focusing on certain goals and then giving you an ability also to look back after 3 years. Have certain interventions been effective? And that hopefully should help also everyone to learn how to support you better. So I showed you just kind of the number of areas that we were connected, but this slide is a really important one for us because in 2019, when we had our big conference in Amsterdam, and many on the call were actually at that event, we said we will do 3 things. First, we want to make sure we pilot things. We want to make sure it actually works, what we are coming up with. Then at some point in time, when we see it works, we're going to open up. And we want to really work towards big data for healthcare, to compare healthcare approaches in different countries and to drive better research and in the end of the day, better quality of life, and really learn together how to improve quality of life. So we said, this is the trajectory and we hope we're going to get there at some point in time. And this is really now where we are in this 3rd big stage. So from 2018, with monthly meetings since 2018. I'm just still amazed that we were even able to do that without funding from any pharmaceutical background or so. It's completely volunteer work. And obviously the general funding that goes to the Care for Brittle Bones Foundation. We've been able to really get it to that implementation number 2, the registry, the number 9 kind of activity block on the right-hand side, which really is now scaling up and making sure it's open for everyone who wants to chime in. In this Key4OI registry, I want to highlight a couple of things. So how does it actually work? Really bring that to life, because measuring one thing with an individual patient in a local hospital or expertise center or national expertise center, I don't want to diminish their importance, is one thing. It will be very, very useful for the individual. But we are in the year 2025, which is a year where there's a lot possible when you have structured data available. Every company, every organization is really striving to find patterns that we were not able to see before without a lot of time studying data. And I do believe it's not just AI, but really with a lot of data in one place, we surely can find new insights and better approaches for the quality of life. So the Key4OI registry, just a little bit for the IT people here in the call that are interested in this, because it's so important, is hosted by the Netherlands Heart Institute. That is a kind of foundation that is built out of all the university hospital heart departments of the Netherlands. It's just a bit of a weird kind of place maybe, but they are absolute experts with regard to the REDCap technology that we're using. REDCap is a non-profit database which is used across the globe. You see that on the picture here. And it has really served for bringing data across the world together, from China to Chile and everything in between. Very useful for us because we had focus groups in China and in Chile and in many places in between. For us, for the Care for Brittle Bones Foundation, who kind of managed everything in Key4OI, but also initiated the whole thing and supported everything throughout. Since we exist in 2012, everyone with OI, regardless where they live, is equally important. And because of that, we really needed something that does justice to that accessibility we want to create. So South Africa, for example, are we able to provide tools that they can also run on their systems? And are we able to make it useful for Ghana, for the multidisciplinary team there? That is really where I believe there will be huge value if we can get it that far, that we can all contribute to those insights in every place around the world, so that cost is not the factor that will determine access to learnings and insights. So briefly on the how the information gets into the system and how information will get out of the system, and where we are also today in our process towards creating that registry, because we are really in the early stages. And I want to not make it too big, but I know for sure that we will be in a certain place by the end of the year, and therefore I can speak with confidence about where exactly we are going this year and the years to come. So where are we right now in this registry? The registry at the moment is consisting of 600 records, 600 patients. And we will probably, by the end of the year, have about 1,000 uploaded into the register. What is very important is the aspect of privacy. And I'm sure we'll discuss that also in a conversational mode in a moment. The registry is a federal registry. And what you see here on the right-hand side is that there is at the center an expert group, a steering committee, a consortium of hospitals. That is really where all the decisions get taken. That group in the center that really is representatives from the consortium members, the participating hospitals, and we'll see that in a moment again, who that is at this point in time, plus the Care for Brittle Bones Foundation as a kind of manager, administrator of the registry. So that is really where all the decisions are getting taken at this point in time. When somebody says, I really think I would love to join the registry, that cannot be an individual. The way this registry is built is that it's a federal registry made out of hospital databases. That's a choice. We felt this was the best choice for this registry because we also wanted to make sure it is as safe as it can possibly be in this tricky time today. So what it really is that the hospitals collect the data, they make sure that there's consent from the patient, and if they have all of that, and you see that, I don't know if you can see my cursor here. Here's the consent, for example, of the individual patient that's required. If all of those things are in place, and if the hospital has agreed with their ethics committee that the data can be shared with the registry, and we have agreed that the hospital can be a consortium partner, then the data goes into the Key4OI database. So what I'm saying is I'm making it a bit slower. So first of all, the first condition is that there is a hospital that is a consortium partner. Otherwise, no data gets into the system. That means that the hospital needs to be ready to collect all the data of this little round thing that I showed. That's a lot of work. They need to really think about how they integrate that into their work in the multidisciplinary team. It's a big choice. We have in the next conference that is coming up in Hong Kong shortly in October, we have a couple of hospitals that want to make that choice, but we really support them so that they understand what they're actually getting themselves into and how they can use, for example, this Key4OI Compass or the checklist in their routine support to people with OI. So when the hospital really wants to go for it, great, we are totally delighted. Then they need to do their own ethical committee check. There is already a ethical committee review that has taken place for the registry as such. And we have received green light from the Leiden University Medical Center in May 2024 already. So it's been around for some time. So in the Netherlands, the ethics has already been approved for all the hospitals in the country. But other countries have other rules and they need to do their own thing according to the national laws and regulations. That way, the information can go through the hospital with the additional consent of the individual into the database. So that is how data gets into the database. And yeah, there's some more details, but I think I spare you those. You can always ask for more. So then how does the data get out? So we haven't really had that situation because we're still at the moment focusing entirely on onboarding everyone into the database. We will have a process to decide. So first of all, proactively for the future, we will have a research agenda. What are the topics that we want to look into? But there are also going to be specific research requests that come to the registry, and we will need to look at them and think if we want to support those requests. And if there's full support, then we can share the data. Now, that is where I want to make one thing extremely clear, which is related to the important topic of privacy. And let me just stop the sharing for a second, because this is such an important thing. So privacy is one of the most important things when it comes to registries. I think we all agree on that. So the way we have constructed is that it is the most safe environment I can possibly think of. And in that, from where I will explain how that works. So it is an environment where there's no names involved. There's no emails involved. There's no mobile phone numbers involved, and no other data that could personally identify you. So it's really, even if somebody was able to hack it, I still wouldn't be able to tell whether my own daughter is in the data set or not. That's simple. So it is really, it is coded. Every patient has a certain code, and the code is with the hospital. And that makes it, yeah, just maybe less practical to work with, but surely safer to make sure that when something is going wrong, because I think we have seen often enough that things can go wrong, that even then things are not on the streets and causing you a concern. So I'm briefly showing you something that you may not have seen yet. I'm switching to a website where you can find more information about this important topic. So here is the Key4OI website. Let me start with a proper homepage, so key4oi.org. Very neutral, yes, because this is not about Care for Brittle Bones or whatever organization. This is simply about us in the OI community working together for collecting data in a responsible way. Under resources and registries, you can see here the registry tab. And here, if you scroll down, you find the frequently asked questions FAQ, which is always annotated with the latest version. So you know if something new has been added, then it will say a new date. And if you click on it, it gives you everything in particular around data privacy in all the detail. So just wanted to make sure that you know where to find this so you can look at the information. So very last slide I'd like to just go into, which is this one, the consortium partners. At this point in time, the partners are the ISALA, the UMC Utrecht, there is the University Medical Center of Hong Kong and the Shenzhen Hospital. I never know if it's one or two, but for sure a very large group from there. The Leiden University Medical Center with Natascha Appelmann-Dijkstra. And we have a list of 6 to 10 hospitals that do also want to join. But that is exactly what I was saying in the beginning. We really wanted to make sure we first show with the parties that have been involved from the very start since 2018. And these are exactly the ones that were involved since 2018, except for the Leiden University Medical Center. They came later, but everyone else was around since then. Now we know it works for them. And now we can scale things up with other hospitals who may want to be joining. So that was the key information from my side. So just summarizing the why, the what, and the how. The why really is the essence of why we're probably all in this on a Sunday afternoon or on a Sunday, wherever you are. We're trying to improve quality of life. And we do this in a collective way because nobody individually, no one hospital can really see patterns easily because OI has so many different aspects, right? So if we bring things together, we will all benefit, having better insights about OI, and we will be able to consistently measure if things are actually improving. 2 different medications. At the moment, 2 different measurement sets are being used. You will not easily notice what is better or not better. If we're using the same system, that could be a very smart step to have some comparability, at least to some extent. It's never easy, but at least it's a way to accelerate and make comparability easier. So why is really the whole space of quality of life. The what is this round figure that I showed you, all those areas that really matter to most people with OI from cradle to grave, from the very beginning of their life until they're hopefully very, very old. And we really want to understand the consequences of things that happen at youth in terms of their medical treatment and at the later stage. So we need to see the continuity of the life course. So this registry is really built for the long run and therefore very low cost, so we can really keep it up for the long run and not dependent on big subsidies that will crash maybe in 3 years down and then we have nothing anymore. That will not happen in this case. And the how is really, it is, we've put together the infrastructure, but now it's really about making sure we bring as many people through the hospitals and expertise centers into the registry. And then we create really relevant research questions together that we could not resolve on a small scale basis where we do need the kind of bigger numbers. And then hopefully we can make it very exciting. So I'm looking forward to your thoughts and questions if you have any, and would like to be a bit in a dialogue with you. But thank you very much for being here.